Not a lot of people know that your foot position can also be a factor in your knee pain. It can cause it or it can make it worse. So in today's video, I want to share what your foot position can have to do with your knee pain, an experiment for you to try on your own so you can hopefully see what I'm talking about, and what you should and definitely should not do to try and fix it. So hi, my name is Catherine. I'm the founder and principal therapist of LSM Clinic, a sport and remedial massage therapy clinic in East London. In this channel, I share information about how the body works and smarter muscle care so that you can prevent injuries and live pain-free or as close to it as possible. So let's talk about foot position. Now, I've done yoga on and off for a really long time, and one of the things that most teachers would tell us is that we should think of the foot like a tripod. Now, I'm going to put a picture up here of the foot as well, but using my hand just for the purposes right now. If you imagine that these are 5 toes, right, and this is the big toe and this is the little toe, this is the knuckle under the big toe and the knuckle under the little toe. These are 2 points of the tripod, and this is the third. Your heel, the back, the middle of the heel is the third. Now, in an ideal position, the heel does a straight line to the middle between those 2 points. And that's the tripod, that's your support, right? Now, obviously it looks different on a foot, which is why I'm going to put the picture up here. However, most of us feel like that's uncomfortable. Most of us probably have our first big toe forward, whereas if we're in that tripod position, the second toe is forward. So what difference does it make to your knee? If you can do this now, do it now. If not, watch it through and then try this another time. Sometimes it's good to hear instructions before you try them. But basically, if you can, stand up and look down at your feet. Like shake your feet out and put them in a relaxed position. And then look and see how your feet are. Are your second toes forward on each side? Or is it more like your big toe is forward? Or are they like pointing out that way, right? Like where are your feet? Now, your foot turnout can come from your lower leg or it can come from your upper leg. And we're going to talk about how you can adjust it after we do this experiment. But basically, if your foot is forward, it gives more support to your knee than if your foot is turned out. And what I'd like you to do is have your feet, put them in that ideal position, which is the second toe forward. So you've got that tripod. Then you're going to bend your knees and see what your knees feel like. Now, before you bend your knees, just check and make sure this is not too uncomfortable. Because if your feet being forward in this ideal position feels like totally twisty and really uncomfortable, then you need to come out of it a little bit because you're going to be so uncomfortable you're not going to be able to notice the difference, right? So check if it doesn't feel too uncomfortable. If it's super uncomfortable, come out a little, not to where you were when you started, but like something halfway maybe. And then bend those knees forward and bend them forward, right? Not like out over your toes, but forward. And I want you to notice, what do you feel on the inside of the knee, the outside of the knee? Like where do your knees want to go? Like how far down do they bend, etc. Then I want you to go back to either your natural position if you were naturally turned out, or if you're not naturally turned out, go ahead and turn those feet out. So maybe it's like 45-degree angle. Again, something that feels within your comfort range. And bend your knees forward again. So remember, when you're walking, you're not going to be like bending, you're not bending your knees out to the side to match your feet. You're usually moving forward. Now, I want you to notice how the inside of your knee feels and the position of your knee. Can you notice that your knee folds in a little bit? Can you notice there's a pull along the inside of the knee? Can you notice that it feels like there's not as much support under the knee when it's bending, when the foot is turned out? Now, if you might not feel any of that, and that's totally fine because sometimes noticing these things take practice, but for most of the people that I take them through this, they do notice a difference in the support under their knee. Now, if you've watched any of my other knee videos, you know that it's the job of the glutes to stabilize the thigh and the pelvis to keep that knee in position. So it's not like the foot position is the be-all and end-all for the knee, but hopefully you can feel by doing this experiment that it's much easier for the knee to fall in when the foot is turned out than when the foot is straight. And you can just imagine, like, especially if you're a runner or if you walk a lot, every time your knee is bending, because it doesn't have that support of the foot if your foot is turned out, it's kind of collapsing in. You have the compensation trying to stop the knee from collapsing in. It might be pushing on the inside of the knee. It might be making that outside thigh muscle, the vastus lateralis, work harder. All of these things are happening if the knee is falling in, which is worse if the foot is not in the right position. So I've had plenty of people where everything else seems okay, but then we don't deal with the foot. We have to deal with the foot position before their knee stops hurting when they're running or when they're walking around. So let's talk about how you can fix it. And if you didn't feel it in that experiment, feel free to save it and try it again later. Or, obviously if you are local to us, we can help you with it in a session. So what do you do about it? So what you want to do is you want to make it so that it feels natural for your foot to be in this position. And the opposite, which you absolutely do not want to do, is force yourself to walk with your toes forward in that position, your second toes forward, if it feels really uncomfortable. Because if it feels really uncomfortable, that's because there are muscles elsewhere that are pulling or trying to put you in that position. So all you're doing is creating more tension. You'll probably put yourself in not the ideal position because it feels too weird for you to know what feels natural. And then you're going to create other problems. So absolutely do not force yourself to walk in ideal position with your feet, which is like that second toe forward, that tripod position. Do not make yourself do it if it feels uncomfortable, because you will create other problems. Like, hopefully I've emphasized this enough now. So what you do want to do is you want to figure out, why is my foot turning out? And it's usually one or two or a combination of these two reasons. Usually either there's muscles in the lower leg that are tight, that are kind of spiraling your lower leg out, so your foot's going out to the side, or there's muscles in your hip, in your thigh, that's turning your whole leg out. And the way that you can tell the difference is if you look at how your foot's turned out, you can look, are my foot and my knee turned out? Or is it my knee forward and my foot is turned out? If your whole foot, your whole leg, your knee and your foot is turned out, you can do the piriformis stretch, which I've talked about in other videos. I will link one of the videos about the piriformis below. And if it's just the lower leg, you can just foam roll the outside of that lower leg. And by releasing those muscles, your body will naturally go into that position. So you don't have to force yourself. You don't have to twist anything. Honestly, it could really damage your knee if you're twisting yourself forward when all of the other muscles are trying to twist you out. So it's much safer and more effective and more comfortable and more doable in the long term if you release the muscles that are pulling you out instead of trying to force yourself to go forward. And if you're not sure how to release the muscles in the outside of the lower leg, I have a foam roll workshop that is free that you can download. I will put that in the description below as well. So there you have it. What about the foot causes knee pain is if your foot is turned out. How you can test it, I'm not going to repeat that whole thing, but you can go back to wherever the timestamp is for how to test it. And then how you can fix it is addressing why it's turned out. And what you should absolutely not do is force yourself into that position if it feels uncomfortable. That is the foot position in knee pain. Next video, I'm going to talk about how you can be doing squats and lunges and actually be making your knee pain worse, and how to tell if you're doing squats and lunges in a way that's bad for your knees and how to fix it. So thanks so much for watching. Thanks for going through this playlist. If you have any questions, feel free to leave a comment below. If you'd like to see more of these videos, please subscribe, hit the like button. If you'd like to get my emails, there's a subscription link below. I think I've covered it all now, so I will see you in the next video.